My name's Melissa Lukes, and this is my A2 Assessment Professional Development Plan for subject NS 3772. Reflective practice is a critical component of nursing, according to research from the Australian Health Practitioner Regulation Agency 2020, allowing nurses to learn from their experiences and improve their nursing practice. Reflection on nursing using the Gibbs reflective cycle, which consists of these 6 stages: descriptions, feelings, evaluation, analysis, challenges, conclusion, and an action plan. As part of the Nursing and Midwifery Board of Australia's Standard of Practice 1.2, nurses are encouraged to reflect on their experiences to improve and shape their practice. I also found this reference. It is also important that students are encouraged to feel safe enough to be open-minded and allow their attitudes, beliefs, and values to be challenged. And this can be achieved through reflection of their own experiences and also on the experiences of others. Reflecting on what we can do helps us to identify and understand our caring values. Among the sources of reflection identified in the journal article Ingham Bromfield 2021 are everyday events, and positive and negative experiences are a process of reflection and how we should honestly examine how our situation has impacted oneself, enabling the exploration of actions and evaluations of our understanding. I'm yet to go on my 6 and 8 week placements, and they are scheduled for next year, so I will draw upon my experiences as an enrolled nurse at the Mater Private Hospital. During my experience as a surgical ward nurse, I gained real-world experience, interacted with patients, and work alongside experienced health professionals. In my reflection, I will share my experiences, challenges, and lessons learned during my employment. One of my most memorable experiences during one of my shifts was caring for a patient with an ICC drain along with a registered nurse. During my time with the patient, I observed the importance of appropriate competency and training for monitoring and recording ICC drainage. I also learned that listening and providing reassurance significantly improved the patient's overall well-being when they expressed anxiety about having the drain in situ. This also aligns with patient-centered care principles, which stress understanding patients' needs and preferences. One of the challenges I faced was my lack of knowledge and education regarding ICC drains and the nursing considerations that the RN addressed. The NMBA Code of Conduct 2.2 decision making requires me to recognise when an activity is outside of my scope of practice that I should discuss this with my buddy RN to ensure that the patient's best interests is preserved. We also had 6 other patients between us, so we had to manage our time effectively. Keeping track of multiple tasks while ensuring every patient received adequate attention was challenging. Staying organised and prioritising tasks became more important to me throughout this shift. And using my RN's guidance, I developed strategies to improve my time management skills for this shift, such as creating a shift planner and for nursing tasks within my scope of practice. The importance of teamwork in healthcare was reinforced by this experience. I collaborated with nurses and doctors and other healthcare professionals, which gives me a comprehensive understanding of patient care. It is essential for successful teamwork to communicate effectively and respect each other. I did benefit from these hands-on experiences, while also recognising my lack of knowledge and clinical skills regarding ICC drains. And as I reflect on this experience, I recognise the personal and professional growth I've achieved. As a result of this shift, I was forced to step outside of my comfort zone and adapt to a fast-paced and dynamic work environment. It also highlighted areas where I need to improve, such as time management, clinical decision-making, and upskilling. My overall enrolled nursing position has given me invaluable learning experience. It has provided practical skills, enhanced my understanding of patient care, and underscored the importance of empathy and communication in nursing. I am grateful for the support and guidance from my mentors and colleagues, and I look forward to applying these in my future nursing practice as a registered nurse. I would also like to reflect upon my student placements at Townsville University Hospital on Med 5 and the Planned Procedure Unit. Student placements and my home life balance was incredibly challenging to manage. I found myself overwhelmed trying to meet the demands of my academic responsibilities while also trying to fulfill my obligations. The NMBA Board of Australia has a registration standard for continuing professional development. I believe that this struggle could lead to enrolled nurses and registered nurses feeling constantly stretched too thin. A registered nurse must complete 20 hours and 10 hours to obtain an endorsement of personal and professional well-being. And as a nurse, the demands of my job can often leave me feeling overwhelmed and stressed. Reading articles, in this reflection, I will discuss the importance of work-life balance and its impact on my personal and professional life. Amy M. Higgins' doctoral dissertation on work-life balance best practices highlights the challenges nurses face, such as burnout and high stress levels. It discusses the consequences of work-life balance for patients, organisational costs, and nurses' turnover. And among the recommended strategies and programs to address these issues are stress management and mindfulness training, professional development plan. In addition, the importance of promoting a positive work environment. I do have another year of study and such as Watson's theory my plan may change after and engaging, and I'm hoping to complete my bachelor by the end of September in 2025. Several research studies explore topics related to nursing practice, on organisation support for nurses, career planning and interventions that affect nurses' well-being and organisations need to reflect nurses' career planning and development in their values, flexible workplaces, and organisational strategies in order to achieve on consistent work performance evaluations. Much of the literature from a nurse unit Queensland Government 2023 website and focus on my nursing satisfaction with developing structures for my CPD agreements, continuing education. From my reflection, I identified two goals and collaboration with educational institutions and enjoying a work-life balance. My SMART goals are presented as follows. I have laid out 1 to 4 step process that I would like to meet in my first year. This includes staying on the surgical ward at the Mater as a registered nurse. I would like to complete the orientation and training relevant to my ward. I would also like to perform self-assessments in regards to identifying strengths and improvement for my surgical ward nursing. Continuing my CPD as per my SMART goals, and increase my knowledge in regards to ICC drains. And continue to build rapport with my colleagues, supervisors, and interdisciplinary teams. My second year is about building competence and confidence. I would like to see myself pursue advanced courses for IV cannulation, discuss my career goals with my nurse unit manager, perhaps take part in preceptor courses, attend a nursing conference, and focus on improving patient outcomes on the surgical ward. In my third year, I would like to see that my knowledge has deepened in my specialty area, staying updated with the latest research and best practice, take on roles such as a preceptor for new nurses, and continue to seek mentorship and guidance from my nurse unit manager. In my fourth year, I would like to see myself transition into leadership or advanced practice roles. Pursue advanced practice roles such as clinical nurse specialist and enroll in the relevant graduate program, and mentor junior nurses and guide their professional development. My goal for my fifth year is influence the nursing profession and healthcare system with my skills, knowledge, and experience.